Focusing on winning arguments, we're teaching the basic fundamentals of sales and marketing and how we can use them to win in the world of politics, teaching you how to meet people where they're at on the issues they care about. Welcome to The Brian Nichols Show. Well, hey there, folks. Brian Nichols here on The Brian Nichols Show, and thank you for joining us on, of course, another fun-filled episode. I am, as always, your humble host, and today, special guest, short notice, but I'm super excited to have this guest. We are talking about pediatric cancer and how we can fight back using cryptocurrency and the blockchain. Jacob Beckley from the Beckley Foundation. Welcome to the Brian Nichols Show.
Hey, thanks for having me on. It's great to be here.
Absolutely. Jacob, thank you so much for joining the program, and thank you for the short notice. I was talking to Eric, your assistant there, early AM before my workout, and I said, wow, this is some awesome stuff. We need to go ahead and get Jacob on the program, and thankfully, we were able to get you on the show today. So thank you for joining us, and I'm really excited for this conversation because right now, I know a lot of people are looking for ways that they can help people who are in need, and sometimes they look at their dollars and they say, man, is my dollars going to be worth what I hope they're going to be worth and bring the value that I hope they're going to bring the value? And we're seeing the dollar lose its luster. And thankfully, we have some alternative technologies out there that are helping give awesome organizations like you over at the Beckley Foundation help with some amazing causes that are out there. So let's first start things off. Jacob, introduce yourself to the Brian Nichols Show. And what is the Beckley Foundation?
Yeah, absolutely. So my name is Jacob Beckley. I am the chairman of the board of the Beckley Foundation, and this is a foundation that was started in 2016, a nonprofit organization. And our mission was to help fund underfunded pediatric research and build awareness around that devastating disease. So we have done so many things throughout the years. A small foundation, but we've raised, 20,000, 30,000 a year, 50,000. And then I did a couple of crazy events. I built a boat and rowed across Lake Michigan to raise funds and raised quite a bit. And then that caught the attention of Charles Peanut Tillman, formerly of the Chicago Bears. Mm-hmm. And he and I did the same thing. We built a boat, designed it, built it nights and weekends, and then rowed across Lake Michigan. And then since then, we've started Cure. And I can tell you a bit about why in a bit here.
I would love that. Yeah, because that's awesome. You get to hang out with the Charles Tillman there from the Bears. Why not? And he's famous for the peanut swipe there, when he'd rip apart the football.
Peanut punch.
Peanut punch. Thank you. I'm a Cowboys fan, so that's my I guess cross to bear there. But no, Jacob, this is fantastic stuff because right now, and I would love to hear as you start things out why the Beckley Foundation came to be. We're seeing though, like there are a lot of people, much like you, who are looking to just get involved and try to start making a difference. And I think right now in 2022, the opportunities for people to actually take that step, they weren't there before. Now it's not only it's there, but it's actually a lot easier than it was in the past. So let's talk about that, but also let's dig into what I guess was the precipice for you starting off the Beckley Foundation.
Well, there's specifically a few things. I have been raising money since 2011. And, pediatric cancer is really dear to my heart. I've met so many families, hundreds of families that have either children with pediatric cancer or who have unfortunately lost their child to pediatric cancer. And, my day job is I'm an executive within a innovation firm. So I focus on dissecting problems, figuring out how to come out with new approaches, new solutions to problems that exist today. And I feel that by focusing on pediatric cancer, we're going to have cascading effects throughout all forms of cancer. And that's already been proven today. So we've started raising money for, specifically in Chicago initially, for Lurie's Children's Hospital of Chicago and now Rush University of Chicago as well. And we fund research labs and that focus on cutting edge research and trying to find a cure inevitably. They're trying to improve treatment, make chemotherapy stronger, more tailored, and also working on trying to get rid of this catastrophic disease.
Yeah, I have a little cousin who he's 7 years old and got hit with lymphoma. And it was just, it crushes you because you look at the child and you're just like, you're a kid. You didn't deserve any of this. You're just, bright-eyed, bushy-tailed. You have your life ahead of you. And he spent the past 2 years going through tests and bone marrow transplants. I mean, you just go through the list of things that he's had to go through in his little life, and it breaks your heart. And to your point, nobody wants to see children, the most innocent among us, suffering. And the fact that you're taking the step and trying to do the research that not only help those kids in need right now, but to help prevent the kids of the future from having to go through just all this pain and suffering that we've seen happen over the years. So let's talk about some of the successes you're having right now. You've been doing the research since 2016. Obviously, you must be having some success getting the eyes of NFL veterans. So I would love to hear what success you're finding over the Beckley Foundation and actually helping with pediatric cancer.
Well, it's quite a bit, but initially when the foundation started, we weren't raising a lot of money. I think the first year that the foundation was in existence, I think I raised about $3,000. Nothing much, and that was from just putting myself out there to help build awareness. But each year it grew significantly, and since 2016, both personally and through the foundation, we've raised about $1 million, which is a significant amount of money, and for a small foundation in those years. And, one of the challenges that we had coming into the pandemic, once that hit, the whole world changed.
Yeah.
But the thing that changed for foundations is that all fundraising kind of stopped. We used to host in-person events and where you'd have silent auction items, cocktail parties, things like that to help raise funds. And we couldn't do any of that. So we had to pivot. And what better place to pivot than what I'm passionate about, technology, cryptocurrency and philanthropy, and tie it all together with a little bit of innovation, and you come out with a new form of cryptocurrency that's focused entirely on building awareness and supporting research in pediatric cancer.
How about that? And that's where I wanted to really dig in today. You've developed something that is so revolutionary in the way we help fund these different forms of research. And you've developed the Cure Token, which I think is a fantastic idea and a fantastic name. I'm in sales and marketing. I trust me. I see a good name like that, I'm like, ooh. And I loved when I was looking at the website that you're the first to do this, and you're revolutionizing the way that people are being able to donate money. So let's talk about that. What has been the feedback that you've received from the public in terms of, number one, the ease of being able to make these donations, but number two, have you noticed anything in terms of the types of donations? Have they been better? Have they been worse? Enlighten us.
Yeah. So, cryptocurrency is an asset, so it's a tradable asset, just like you would have like Bitcoin or Ethereum, Cardano, Solana, and also it's like a stock, for example. So what people do is they buy a piece of this, just like you would buy a share of a company, and it fluctuates in price. The more people that buy it, the price goes up. The supply goes down, and out of that, every single transaction, there's a 4% transaction fee that goes directly to the foundation. And what I'm proud of is that our foundation is $1 in, $1 out. It's not a foundation that is scaled so large where $1 in and 20% of it goes out to people in need or the actual mission or the cause. So $1 in, $1 out. So 4% of that is accumulated quite fast. We were at a point where we were at a $56 million market cap, and with the foundation was pulling in about $10,000 a day, which is not an insignificant amount of money considering, the year prior it was so difficult to even raise 50 grand. So it's a big shift. So the challenge that we've had though is because this is a tradable asset, and people in cryptocurrency are really only out about making money. They want to double their portfolio. They want to, increase, how much money they actually have, at the end of the day. So they're always looking for new projects, new cryptocurrencies to get involved in. That's been a challenge for us because what I've tried to do is tap into those people with that mindset, but try to get them to think differently. You can make money. You can, put your dollar out there and hopefully it'll, double or triple. But at the same time, you can actually do some good, or you go to bed at night and think, I'm actually helping out, I'm actually making a difference. And we've made a significant difference in the past 5-6 months here in the amounts of research we've been able to fund, the amounts of direct family support that we've been able to help out with. Getting a child with cancer isn't a choice. It's not like you opt into it. It's something that just happens. And more times than not, when you have a child diagnosed with cancer, you immediately go into financial burden, and you can't pay sometimes your mortgage or your rent. You can't pay for care or your car payments, things like that. And we connect with hospitals throughout the U.S. and now in the world, which we've never been able to do before, and find these families, connect with social workers, and make a difference. Whether it's paying a car payment, fixing an air conditioner, building a ramp outside of a house, whatever these things are that we can help support to ease that burden so that the families can have a better quality of life. That's or not even better, just consistent, quality of life that they may have had prior. That's what we're trying to do. And even so far as you mentioned, lymphoma, there's been a few families that we've supported where the children have been diagnosed at such a young age, and their whole world, the kids and their families, their whole world revolves around cancer. The whole every part of their existence. And these families haven't been able to, like, for example, ever take a vacation, ever. And so we granted a few trips to Disney World with a charity out there called Give Kids the World, and we were able to grant trips to these families and create memories for them, and something that they're going to remember forever and cherish. So we've been able to do a lot, and I'm just excited about where we've gone, what's on the horizon, and just all the great things that we're going to be able to do here in the future.
Yeah, well, let's talk about the things on the horizon. And obviously that involves people getting involved and being able to help support and start things off. I want to learn, how do we go ahead and get this awesome new crypto out there, Cure Token, number one. And number two, I mean, you mentioned that it is just like every other cryptocurrency, but is there any limitations that people have to be prepared for when they go into this world of the Cure Token?
Yeah, there is. Cryptocurrency's kind of a scary place. I mean, it's, cryptocurrencies in general, I mean, you talk about mainstream cryptos, Bitcoin, Ethereum, you can go to Coinbase, Robinhood, Binance, things like that. They're very traditional methods of entry. When you start talking about some of these more complex cryptocurrencies that aren't yet listed on those tier one exchanges, it can be really daunting and difficult to buy. So it's our project is currently on the Binance BNB smart chain network, and it is, I'm telling you, it's really hard to buy. So what we did is we developed a new technology called CurePay, which allows people to go to a website, which is pay.curetoken.net. They can say how many Cure token or how many US dollars they want to spend to buy. And it's just like buying a pair of shoes online. Like, that's it. You don't have to know about wallets or exchanges or swapping tokens. We just made it really simple. And we do all of that. We automate that entire process, which is a pretty complex process, automated in a few seconds programmatically through technology. And then at the end of it, you get access to a dashboard that shows your tokens, where you can interact with them. You can send them to a wallet once you become more sophisticated on what a wallet is, a software wallet, or you can buy them, buy more, trade, sell, things like that. So we try to simplify the process. But I'm in technology, and the first time I tried to buy any cryptocurrency at this level of cryptocurrency, it took me 2 days to figure it out. It's not an easy process. So what I want to do is really simplify it, and now it takes seconds now for anyone, even a novice user.
That's amazing. And that's right there sometimes the biggest challenge, right? To get new people to embrace this new technology is it's difficult. My day job, I'm in sales, and my focus is exactly in that, the business technology world, cybersecurity, phone systems, bandwidth solutions. And the number one challenge I face is getting people to say, yeah, this looks great, but will it look great for me? And to be able to bridge that world and saying, not only is it possible to get this new solution that's going to make things better, but it's not as hair pulling of a process as people think it is. So let's talk about that. And I would love to dig more into right now the community that you're building. And I think that right there maybe is something that we're seeing a lot with this crypto environment, is it is building communities, because each crypto kind of is in essence, its own. So it's its own dollar. I mean, it's its own money. And it, just like a country, when you have your dollar, like, that's for that country. And now it's like these dollars are for these little communities. So what's the community looking like for the Cure Token, and how is that community growing?
Yeah, we've actually been growing at a pretty steady pace. Last time I checked, this was a while ago, but I think we were at about 20,000 people throughout all our different social media platforms. And these are people who opt in, who are interested in the project, who want to get involved. I mean, this is something that's pretty crazy when I tell you this. But this isn't just me running this. When I started this, it was just me. But now we have about 180 people behind the scenes that are involved, and these are people who are handling social media, working on different marketing tactics, knocking on doors, setting up meetings. I mean, all these different types of things. It's a lot of people to come on board a project. And why people are coming on is because they believe in it. They believe in the charity aspect of it. They believe that we're doing a lot of good at the end of the day. So it's a really strong community. And this is, these are volunteers. These aren't like people who are, making making additional income from this. This is all for charitable charity's sake, and they just want to get involved and do some good. So I think that's a testament to the community that we're growing really rapidly, and that the people aren't just there passively engaging, but they're significantly and making a difference through their engagement. And that's been pretty remarkable. And I don't think a lot of projects see that, type of community support.
Yeah. Well, and let's maybe tell one of those stories. I was on the website earlier and I was reading the story about a little girl named Kate. Can you tell the story about Kate?
Yeah. This is, Kate's great. I'll tell you a story about the pandemic and Kate. My wife and I, get so invested with the families that we support. And we try to stay connected with them, try to help them, try to find ways to make a difference personally, and also through the foundation, obviously. But in the case of Kate, when the pandemic hit, she lives here in Chicagoland, and she was getting treatment in New York at Sloan Kettering. And right when the pandemic hit, it was really uncertain times. You weren't sure how bad it was. Traveling became difficult. She had a deficient immune system, so she wouldn't be able to fly on a traditional plane. So her mother was going to drive her to New York, and we said, no, let us do it. So we had an RV. We put her in it, got her comfortable, drove to New York. It was like a valet service, or Uber. We just parked in front of the hospital and then drove off once she had her treatment completed. And that's the type of stuff that we do from a foundation perspective as well. But Kate's great. She's actually in remission. Actually, I think it was 2 or 3 days ago, I received a text from her mother that her scans were clear. And she was diagnosed with neuroblastoma, which is the most aggressive form of childhood cancer. It's very, very aggressive. But she's a survivor now. And she's just a remarkable young girl. And I can't wait to see what she does with her life and all the great things she's going to be doing. But yeah, great individual.
In that, I want you to share that story because, I mean, Jacob, you're having the opportunity to give kids a future. And I mean, it's really personal for me with my little cousin. He's fingers crossed. I know he had a test today to make sure that he's still in remission, but I think he's on second bone marrow transplant. And this one seems to be the one that took. And, it's just the idea of him now being able to have something to look forward to. And for 2 years, him and my cousin, who is his dad, and his wife, they moved from Jersey to Philadelphia to go to CHOP, the Children's Hospital of Philadelphia, and lots of specialists there, and great, like the doctor they were working with is one of the best in this specific area of this type of lymphoma. And with him now having a chance, and just seeing how the family feels, like to know, okay, he's got a chance, and you're giving that to hundreds, thousands of children. And that's impacting real people right now. And I mean, I'm actually a little emotional just talking about it because I know how much it's impacted us. So just thank you, because you're doing something really great, and you're helping not just the kids, which I mean, that's the most important thing, is helping these kids. You're helping their families. You're helping their extended families. And it really is something that it gives me hope, because in all the chaos of the world and the nonsense that we go through on a day-to-day basis, you turn on the news and everything's negative. And just, thank you for being something positive that we can talk about today.
Well, thank you for that. What we do isn't always financial as well. A lot of times, like you said, families, they don't choose this, so they find out in one moment that their child has cancer, and they hadn't done research before on what the consequences are, or what's the best treatment out there. They're learning it just like everybody else does. So what we do is we try to connect them with resources of people who've been through it before, that can help them navigate, can help them understand the terminology, and help them know the different treatment plans. They're different wherever you go. So it's also about that. And I think I want to talk a second about the future state of Cure, because it's an asset, it's a tradable asset. There's 4% that goes to charity, but what is happening is that this is actually transforming into a tool that is going to revolutionize research in the world, and not just with pediatric cancer, but all research. When I was sitting during the pandemic as well, and from this that point forward, everything around our lives is going to revolve around our time during the pandemic. But this is one of those times, So during the pandemic, I was thinking, how is it that we were able to come out with a vaccine so quickly and have it, be readily available mainstream shortly thereafter? And, I mentioned I work in innovation, so I'm always dissecting problems and trying to identify connections and different things that we can replicate. And what I discovered was, after analyzing this, hundreds of different variables, there were really three buckets which really resonated. And that was that researchers had massive access to data, so massive amounts of data and the same data. Okay, then which doesn't really happen today. Second thing is researchers stopped working in these silos and pockets throughout the world. I mean, even in Chicago, for example, there's researchers in the same city working on the same tests, and they never collaborate. So that's a problem. During the pandemic, that all changed. So access to data. You had researchers collaborating, working together. And then, finally, on the third point here is that they were incentivized, motivated. We didn't know how bad the pandemic was going to be. We didn't want it to affect us or our families, our loved ones, our communities. So people had a motivation to want to solve that problem. So what we're building is this new technology, which is called Cure Chain. And you mentioned CHOP, for example, Children's Hospital of Philadelphia. We're actually working with an expert there, Dr. Adam Resnick, is going to be supporting us on this initiative from a research perspective, as well as we have Jim Nasser, who used to be the head of blockchain technology at the CDC. So we're actually meeting in I think a week and a half from now to have our next workshop. But the idea here is we're building a blockchain-based technology that's going to enable research to occur faster. It's going to enable more access to data and a bigger reward. And this is going to become a platform that's community-driven, community-based platform to enable better and faster breakthroughs in research. Research today is funded from the top down, government organizations, healthcare organizations, big pharma sometimes. And we're going to come up from the bottom and make an impact from that perspective. But I could talk about the technical details of it, but really it's a dynamic-based NFT network where people, you or I, can put in our medical information agnostically and anonymously. So there's no personal health identifiable information tied to us. But that has a lot of value, and you should be rewarded for that. And through the power of NFTs and reward-based mechanisms, that's the vehicle. And then there's going to be massive amounts of data coming in. There's going to be queryable data, structured data, proofed data, so proof of stake data, and then researchers are going to be incentivized and motivated through financial bounties as well as community-driven initiatives. So it's a very big concept that we're putting together a pretty top-notch team here to help bring this to life, and I'm really excited to see where that's going to take us. But that's the future of Cure Token and where Cure is going.
Wow, folks, how about that? Because we talk about, creating solutions, building the solutions, and making and you mentioned it, the old ways of doing things, the status quo, irrelevant. And that's what you're doing, Jacob. Thank you for doing that. Your dog agrees as well. Yep. Good. And how about this? With your dog understands we're already close to time too, and I just looked at the clock and I realized we were close to time. So I'm a sales guy at heart. I need a call to action. What can folks do now to go help support the Beckley Foundation and help support this awesome new innovation, the Cure Token?
Well, I'll be very fast here. There's lots of ways. You can go to curetoken.net to check out the cryptocurrency if you're interested in that digital asset. You can also go to thebeckleyfoundation.org if you would like to learn more about the research we're funding and supporting, and you can make a donation there. And then as well, I didn't mention this, but we have a sponsorship with NASCAR that we're doing this year. So you'll see us all over NASCAR this year, and racing in September, which is the month of Childhood Cancer Awareness Month. And you can go to raceforacure.com with the number 4 to learn all about that and get involved. We're giving away 2 cars. We're raffling off a motorcycle, 2 Camaros, raffling off a motorcycle, as well as tons of other prizes that you can opt in to win just by getting involved and participating.
Wow. How about that, folks? We got a call to action, and it's an easy one. And you can win some stuff, too. How about that? While fighting pediatric cancer along the way, using cryptocurrency, why not? With that being said, Jacob Beckley, thank you so much for joining us on the program today. And folks, if you enjoyed the episode, well, please do me a solid. Make sure you go ahead and give it a share. And when you do, please make sure you give yours truly a tag at B Nichols Liberty. And by the way, if you particularly enjoyed this episode, here's what you can do. Go ahead, click the artwork in your podcast catcher. It'll bring you right to briannicholsshow.com, right to today's episode, where you can find all the links for the episode, the entire transcript of the episode. Oh, and by the way, all 450 plus episodes of The Brian Nichols Show. So with that being said, Jacob Beckley, thanks for joining the program.
Thanks for having me here, Brian. Thanks.
Thanks for listening to The Brian Nichols Show. Find more episodes at briannicholsshow.com.